Good morning, and in case you've just joined, this is Good Morning Uganda, your current affairs show on UBC TV. Every weekday you can't afford to miss very informative discussions, of course, as we spice up your morning with some jokes and above all news or the world of current affairs to keep you updated. I'm Robert Chirabo, and welcome to Good Morning Uganda Agenda, where I have a guest in studios and have an in-depth analysis of the issue at hand. This morning, we are going to be discussing the reopening of schools. It is very clear and common knowledge that COVID-19, one of the sectors most hit, most affected, has been the education sector. We saw schools being closed in the first wave. If you remember, the President spoke on the 18th of March 2020, and within 2 days, schools had to be closed. In the second wave, still on the 7th of June, we saw schools close till today. We had a time when we had the staggered way of phased reopening of schools, but soon after the candidates had had their exams, semi-candidates returned, the rest were expected to return except pre-primary or nursery. Then came in the second wave and institutions were again closed. Now with me in studios to discuss this is the Public Relations Officer, Ministry of Education and Sports, that is Dr. Dennis Mujimba. Doctor, you're most welcome to our studios.
Thank you, Robert, for inviting us.
It's really an honor knowing that finally we can have proper, authentic information from the ministry regarding the opening of schools. Doctor, to begin with, we know the education sector was greatly affected.
Yes.
But from the ministry's perspective, to what extent has this affected the education sector?
Thank you, Robert. Now, what the public may not understand is that when we talk about COVID, we don't talk about its impact in terms of the distant things that are very far from us. It actually hit us hard in the ministry. We lost about 2 people, very senior people at assistant commissioner level. We lost a principal of one of the training institutions. We lost chairs of boards and university council. So we've been hit hard. We've also lost parents. But the loss of parents was mostly pronounced before the second lockdown. So it's something that is very sentimental to us. Number 2, when you look at the processes we have, because we also have the work plan to implement, because government allocates us resources. We have plans of building all these schools, all these institutions. We had given out tenders, but work is not progressing as fast as it could because of the lockdown measures. So that is an impact. And you know, these resources that we have as a sector, when you get a contract, Robert, that money is not going into your pocket. You're giving, it's going within the community. So our lack of pumping resources into the projects because of the impact of COVID definitely has a ripple effect on economic growth. Now, you also have our babies, let me call them learners, but our precious asset, who are the learners. Those were hit the most. Some of them have not been to school since March 2020, when we first locked down. And mainly we are talking of the kindergartens, as well as up to P3 and P4. Now, you also have those of Senior 1 and Senior 2. When we reopened, they had just a tip of in-class studying. They only came back for only about less than 8 weeks. And remember, Senior 1, they had just had a brand new revised curriculum, very beautiful curriculum. So that was completely disrupted. Now, when you talk of learners, we have about 15 million learners. Now, there is a section of learners who only get the best when they are out in the field. Those are the technical and vocational institution learners. They could not get out to the field because of the lockdown. Some of the places where they go to do their apprenticeship from were locked down. Some were going to bars, others were going to cinemas, because they are doing different vocations in those spaces. But they could not get places to do internship from those places of leisure. Talk of tourism, etc. So there is a lot that our learners have been hit with. Then, of course, you have a situation where not all our country has good internet coverage. Now, when we went to higher education, we were relying on online and distance education approaches. But then you have a huge proportion of our learners who don't have access to internet.
Yes.
They don't have, they cannot afford the gadgets, electronic gadgets we talk about, these smartphones and whatever. This is just a Kampala phenomenon. It's urbanite. They can't. So you find that what is desirable is not feasible, and your hands are tied because you cannot afford it. So now there is also the other providers, because government is not alone in providing education. You have the private sector. Now, they have so many institutions, and many of our learners go to those places. Some of them had credit. They are hit hard because they cannot service that credit. So it's tight, but there is hope that when measures ease, the economy opens up, some of this impact will be mitigated, but we are going to live with some of these effects for quite a long time.
For quite a long time.
Yes.
Doctor, now, even before we go to the reopening, which is good news, that we are going to be discussing later on, let's first look at the current status of the education system.
Yes.
The ministry, we know, reliably informed, a number of monies, millions, have been put aside to ensure continuity in one form or the other. And the question is, what are these plans and how effective have they been? Let's look at that, then we dive into it.
Okay, thank you. So even in the advent of closure of these institutions, we still have been able to do something in the background, especially to ensure that there is continuity of learning at different levels. Now, for the basic education subsectors, basic we really mean pre-primary, primary, and secondary education, O and A level. We had an approach for home study materials. Now, the home study materials really were taken from a condensed curriculum. So what the minister guided about was that Honorable General Museveni guided that you reduce the curriculum to what is core, what the learner must know. In the event that things become tight, they can still progress with minimum knowledge required from that class to the next. So we came up with these home study materials, and we've been printing them and distributing them to learners. Now we've done it in 2 phases. In the first phase, we got 28 billion shillings and had them printed, distributed to schools, both private and public.
At 28 billion?
28 billion. Now, that one did not cover the entire scope of the basic and secondary education. We only focused on primary 5 up to senior 4. Then senior 5 and senior 6 plus P1 to P4 did not receive. Now, there came round 2. Government gave us 48.5 billion shillings. We have already hired out contractors to do the printing. For Central Region, we have a company called Riverflow International, which is going to distribute to the Central Region. For the Western, we have New Vision. It will distribute to the Western Region. Then we have Northern Region, it will be MK Publishers. So we broke down the work into chunks. Now, you'll know that, you'll hear that Eastern has missed. When the advert was put out, the bid for Eastern was too expensive. So we decided to re-advertise. But our timeline, and according to what we have seen, these contractors will be able to deliver within either the last week or first week of October. Now, these materials were delivered. Initially, we tried going through the LCs, but we found a lot of challenges through that path. There was difficulty of accountability, facilitating this local government system at those levels to go to the households. So the most reliable system was going through the schools, because that is what is natural to the education sector. However, we hit a very big hurdle. We realized that when these materials were going to the schools, now, I think for some reason, these schools were not distributing the materials to the learners. When the learners went back home, the materials remained in the school instead of going with the materials home. They are home study materials. They are not library materials for the school. So that is a challenge that we really call upon the public.
But what was the intention of this? Because now you're talking about learners going back to school,
Yes.
back home without them. What was the intention if it wasn't West?
Now, it was, I think it was lack of understanding and appreciation on our counterparts in the schools to know that the design intent of these materials is to help the learner continue studying or learning when they are not in the school. Because even when we reopened and they come to the school, they are not getting the full package. So the home study materials are supposed to top up. Even in our reopening strategies, we are still going to continue with home study materials, but this time really refining the distribution process and ensuring that a learner, you the parent, Robert, when you're picking your child after he or she has been to school for 8 weeks, ask the head teacher to give you home study materials supplied by government, so that when your child is at home, they continue studying, because these materials cover a whole year. And government is doing this for both public and private schools. So there is no what we call sosola. It's not a government thing, and you're not supposed to pay fees for those materials. They are free. You should not buy them.
I highly doubt this will work, Doctor, because teachers, schools make a lot of money out of holiday package. And this may be seen as a substitute for holiday package, which teachers voluntarily are not compelled by law or anything. This may hit a snag as well.
Negative, let's say negative practices and vices in society can be changed through education. Education is just making people aware of what they are supposed to receive, what they are supposed to do with what we receive, what they are not supposed to do.
So for this period, Doctor, as the ministry, what plans have you been having for continuity of learning?
Now, for the basic and secondary education, there is that, the home study materials. Now, for the tertiary institutions, we've also been promoting or encouraging online and distance education approaches. Now, the challenge is that these tertiary institutions, very few of them had initially built capacity for what we call the online distance education and learning, or DEL. Now, this is not the capacity they could suddenly build within a short time, because it needs a lot of infrastructure development in ICTs. You need to train the teachers, your lecturers, the academic staff. You need a very robust support staff in ICTs. Delivering online content is different from you simply downloading a document and posting it on a website. You have to design the content in a manner that it is actually learning, not just reading. So those capabilities, there are very few institutions, tertiary institutions, that have done that. And now we've seen them progressively do that, and they are being really guided by the National Council of Higher Education. Now, by the way, let me also mention that in the 28 billion for home study materials that we provided for our learners in the basic and secondary education, we also catered for learners with special needs. We distributed several types of materials to 122 special needs education schools. These included braille machines, braille paper, sign language dictionaries, etc. So we were not forgetting them. They're also part of this. We also gave them some devices which we call them Victor readers. You record the lessons and then you can play back, especially for those who are able to hear but are not able to see. So we've all been doing that. Then the biggest part that has been making us spend sleepless nights is ensure that we prepare for the time when reopening occurs.
And you mentioned all efforts you've been trying. Yes, we appreciate the ministry.
Thank you.
Biggest question is now, how effective have they been or are going to be? That does not take away the craving for physical learning, because our syllabus is more designed for presence in classrooms. And with these having tried somehow, of course, they are no anywhere next to physical learning in schools. So let's now look at seeing students back to classrooms. How are we moving towards this, and how soon can this be?
Yes, soon is a good expectation. The third approach, which I had forgotten to mention, is that we've also invested a lot in delivery of lessons through radio stations. And we've invested about 600 million shillings in that country to help us with that. To complement all these other efforts, to complement home study materials, to complement the event that learners go back to school for the short time of in-person attendance, still you rely on radio stations when they deliver those lessons. So we've done all that.
But doctor,
now,
even before, because you've brought in that,
yes,
have you had any impact assessment report carried out to know that yes, there is value for money, or is this just a formality that at such a time the ministry was accountable and provided these?
Okay. Now, two ways to respond to that. Number one, globally, it is known to work, delivery of lessons through radios and TV stations. It does work if implemented well. There was a small pilot done in about 15 districts, and it was not done by the Ministry of Education. It was done by one of our development partners. That pilot found that up to 80% of learners in the P1 to P3 age group were actually tuning in and following the radio lessons.
They weren't in quarries, they weren't raising cattle?
Wherever they were. And these were in very rural places. They were in the eastern region and they were in the West Nile deep regions. Number two, there is also evidence that they are not just listening, but they are actually translating that into behavior change as evidence of learning. Now, also as a sector, through support from our education development partners, we are going to pilot an assessment method to find out whether these home study materials are actually working. We are going to pilot it among 1 million learners around the country in both private and public schools. Assessment method going to use, it is going to use a very simple method, a cavity like mine here. You can be able to assess whether a learner is following what they are being taught through the home study materials. This methodology is going to be very transformational because once it works out, we are going to scale it up to even the normal system. So yes, no one planned for home study materials before, but we have found ourselves in this situation, and we do not know when this situation of COVID pandemic will end and lockdowns. So we just have to perfect some of the methods and approaches we have come in.
We do not know when this is going to end,
yes,
and when we shall come to end of lockdowns,
yes,
but we need to know when people are eager, physical reopening of schools. So doctor, let's focus on that, but let me also remind our viewers that you can be part of this discussion by simply sending in a message, a text message, WhatsApp message, that is on our number, which is going to be on your screen. That is our WhatsApp number, 0709 60 25 92. Please send in the messages and I'll be reading them to the doctor, who is the spokesperson of the Ministry of Education and Sports, and he will be responding to all your questions regarding reopening of schools and also the situation right now, long distance learning, reading materials. All this is what we are handling this morning, reopening of schools. Reopening.
Now, what I want to assure the country is that the ministry has a plan. We have proposed strategies to enable us when we reopen, not if, it's a matter of when.
And when is when?
Learning is an interactive process. That when, that decision is going to be determined through the by the political leadership of the sector in interaction with His Excellency the President and his cabinet. Now I've been saying, does it need the President to decide on when schools should reopen? Now, let me help the public appreciate that normally any school calendar, the normal school calendar, we don't even need to consult the President, we don't need to consult the cabinet. That is a normal thing, we always do it. However, the public must appreciate that we are dealing with a very unique situation. That reopening or not opening this time has ramifications that are beyond the sector. And as such, we have to involve all our stakeholders and our partners in decision-making processes. So that is why Cabinet has to come in and the guidance of His Excellency the President. Now, the date of when the schools will reopen will be informed, as the President communicated on 30th July when he was lifting the second lockdown. To be vaccinated means you have received at least one jab of any approved COVID vaccine, okay? Whereas fully vaccinated means you have received all the doses of a particular COVID vaccine. So he said you have to vaccinate all teachers. And we are targeting to vaccinate 550,000 teachers in both public and private education institutions. Now, when we say teachers in our talk, we are referring to anyone who is into the teaching space from kindergarten up to university. So even lecturers, yes, professors, etc. are in that space. All of them have to get vaccinated as a way of protecting our learners and themselves as well. Number two, we need to vaccinate our non-teaching staff. We have evidence, and there is empirical evidence in other countries, that learners who got infected were also being affected by non-teaching staff, food handlers. It is those who support even outside the class. So that is why as a ministry we have come up and said we have to have the non-teaching staff also vaccinated. Now the non-teaching staff who are helping in this space, when you add on the teachers, the teaching workforce, we are talking of about 730,000 people at least. Now also the president guided that we should also vaccinate learners who are above 12 years. Said okay, 12 to 18. However, the reality is that as a country, when we start with Ministry of Health, they do not yet have vaccines that are appropriate for the below 17 age group. So now the minister has guided that let us focus on tertiary institutions. And she came up with a press statement, and the drive has been on that, focusing on tertiary students who are 18 years and above. So that is part of the preparations we have. Reopening date is not going to be determined by only vaccination rate.
Okay, because I was about to ask that.
Yes.
When soon?
Exactly. It is also going to be determined by the trends observed in the communities on how is the incidence of the new cases of COVID-19. And that is where everyone in this country has a responsibility of contributing to reopening of schools. You see, if you move around in crowded places, you're not wearing a mask, you're not observing social distancing, you're not washing hands regularly, you are contributing to the spread of COVID-19. And once these cases go hard, beyond a certain level that the Ministry of Health deemed is not able to be managed by our healthcare system, the schools will not be reopened. So there have been oil etc. For you to say that the vehicle is in good condition, fair condition, not even excellent condition, you don't just look at a gauge for fuel. You have to make sure you look at the oil, the coolant, etc. So
it's a combination of factors.
It is a combination of factors, and some of these factors are not within the control of the Ministry of Education.
Positivity rate, exactly, that will really matter, then vaccination
rate. But the key thing, even if we reopen today or next week or the other week or whatever week, you and I have to keep on masking up, have to keep on washing hands, we have to use the sanitizer, we have to observe social distancing. Robert, that is why even in our strategies, we are saying even if we reopen, we have to reopen in a manner that is safe for the learners. The best interest of the learner is going to be the guiding principle opening.
Well, there are a number of questions for you, Doctor, here, and I'll be reading them from our viewers. I'll begin with Anna here. When will daycares open? How can we teachers, our terrible toddlers, to concentrate at home while we try to teach them? And are there any online classes for daycares? That is daycares. Anna is asking there. Doctor, I think you will take them and then you reply them at once. So it's more of when will daycares open? How can we teach our, this is I think the toddlers there.
Yes.
So then we have, thanks for the show, please, I'm a teacher, and this is, I'm teacher Nelson from Kasanda district. I think if our neighbors, Kenya and others, have opened up education institution, what about us? So I think it's high time to think on Uganda, of tomorrow. I think to think about. So then still, hello, I'm Guma Isaac from Jinja. So that new curriculum just favors only the students in urban areas, since the students in rural areas cannot access the study materials needed in the curriculum. like smartphones and also internet due to data shortage. Good morning. Now we also have what happens to students from Karamoja, cause we received it last time. Sorry, I meant we did not receive it last time. Okay, thank you for watching. Then we appreciate the efforts being put in place by the ministry. I just need to know the structure on how the schools will run amidst the pandemic. And then I'll also read, I think, 2 more. Okay, here we have, okay, let's see. This one is just appreciation. Dr. Mujimba, how can our public schools achieve social distancing when our classrooms were overcrowded before and no infrastructure has been put in place? That is also a question for you. Finally, good morning, Robert and spokesperson of Ministry of Education and Sports. Reopening of schools is solely a responsibility of the government in the sense that we need education, but he says we need education, but also must ensure safety of the students as well. Let's first start with some of those.
Okay, thank you so much, Robert, and thank you, listeners and viewers, for this feedback. Let me really go to that last comment, safety of learners. It is not about fronting the economic interests, because we know there's a big proportion of our institutions that are from the private sector. We are not going to be driven by the economic interest. It is the safety of the learner first. Safety first. I mean, that is a no-go. Safety first of the learner. Number 2, safety of the teacher. In first aid, I was telling you before the show, I'm a medical doctor by training. One of the things you're told, you have to ensure you yourself giving the first aid, you're safe. Don't put yourself in danger because you want to help a victim.
But we had a question, Doctor, in interest of time, in relation to that, where one said our neighbors in Kenya are opening, the positivity rate is higher compared to Uganda.
Yes, and I can tell you it is not, there is a limit to which you can benchmark practices.
Okay.
Practices succeed in a given context. And let me give you an example. The president reopened institutions after the first lockdown. We did so. We reopened for candidate classes, and by the things went well. Then something happened, and really which shows the issues of our society, the indiscipline. We had put up mechanisms saying if you get suspected learners with COVID symptoms and signs, this is how you go about it. Speak out, talk. Some of our institutions engaged in what we call the conspiracy of silence. And epidemics and pandemics thrive in when there is a conspiracy of silence. They are managed better when people speak out. We had a school here in Kampala that had more than 80 cases, COVID cases. It's a boarding school. They contacted the ministry. We went there with the Ministry of Health. We handled the situation. There was no media, hula balloon, nothing. But when we had this silence, conspiracy of silence, but most of the schools, by the way, both public and private, that was the straw that broke the camel's back. When the president locked down again the second time, we know parents who died because they got infected by learners who came from boarding schools, not even day schools, boarding schools. And these boarding schools had never reported in the health system that they have suspected cases. So you're talking about benchmarking. Some countries, the culture of communication is better. This indiscipline of keeping silent when you have a snake under your bed is not there. So we have a limit to which we can benchmark, and I can tell you we are benchmarking. The minister has been asking how are other countries doing, and her technical team have been sharing all these experiences. And most of the proposed strategies she has come up with are actually not unique to Uganda, like the issue of vaccinating teachers, vaccinating non-teaching staff, the issue of phased reopening, making sure that all learners do time, the issue of shift system, where some learners, like if you open for P1 to P3, you're saying that P1 and P2, you come in the morning, P3 come in the afternoon. These have been tried elsewhere.
All those are proposals.
All these are proposals
that you've put,
that the minister has put on paper. And she's going to put before cabinet. She has also come up with a proposal of alternate days, whereby P1 to P3, can you study from Monday to Wednesday, and then maybe P5 to P7, you study Thursday to Saturday. That is a way of answering the question that someone mentioned about public schools being congested, that we can't handle social distancing. But that is how we are, all those are the strategies other countries have actually used. And the First Lady herself, by the way, she visited the refugee camps before the lockdowns. She knows there that a shift system has been working for those places.
Well, Dr. Time is not on our side. We must come to the end of the show. Let me just have your final remarks, more so on reopening date. Please emphasize that, because recently we had false statements that they were scheduled to open within 2 months or a week.
Thank you, Robert, and our listeners, for the opportunity you've given us as the Minister of Education. The choice of the reopening date is going to be a collective decision by the political leadership of this country, led by the President and his cabinet. Number two, any choice to reopen schools will be in the best interest of the learner, to ensure safety of the learner and safety of the teachers. So vaccination drive is very key for us to fulfill, to ensure that our teachers are vaccinated. So I urge every listener today, reach out to that teacher, reach out to that non-teaching staff, reach out to that student in tertiary institutions, tell them, go get your vaccine. Has distributed these vaccines to several sites around the country, and through a collaboration with the Ministry of Education, they have identified specific institutions in each district that are purely focusing on teachers, non-teaching staff, and students. So there is hope. Let us work together. There is no need for panic. Let us continue observing SOPs. The more we observe the SOPs, the faster we shall get ourselves out of this pandemic. I thank you.
I want to thank you so much, Dr. Dennis Mujimba, that is the Public Relations Officer, Ministry of Education and Sports, for having found time. One thing that is very clear, it is going to be an effort that includes everybody. The positivity rate will determine, but also the vaccination rate of teaching and non-teaching staff in schools. So let's ensure we protect ourselves not to contract COVID-19, so that we have fewer people infected with school reopen. We shall not compromise health because of the economy. The words of my guest this morning. Have a lovely day. God bless you. Ruben is here. Very smart this morning. I've taken a long time to see him put on that thing. He knows how I call it. He will tell you so. He has put it on. And he looks really smart to take you through sports updates. I think he's like our coach of Arsenal. I think that's what Arsenal to dress that way. Well, you can't afford to miss him with sports updates. God bless you. Stay safe. COVID is still around.
This is Good Morning Uganda.